So it's going to be presentation first, and then at some point during the presentation, you'll sort of notify when you want the breakout rooms to kick in.
Yeah, there's 2 points. I mean, it really depends how the timing's going, because I said to Jackie when I spoke with her that I'd make sure there's a 10-minute pause between this and the workshop, otherwise 2 hours is quite long.
Yeah. It's a good show. Oh, right, okay.
You got a room full of people with you, have you?
Yeah, sorry for the background noise.
No.
We when we set up these events, it's so much easier to be in the same location, because it's just so much easier to link in with each other and have those conversations. But yeah, we've got a bit of a mission control set up in our building, and we've had special dispensation to be here. So it's nice to see other humans, and
yeah, that must be nice to have that.
Oh, definitely. Yeah, no, it is 100%. So I think either Claire Vaughan or Gareth Hardacre are hosting this, and we'll set you up. I'm not sure who out of those. I've got 2 names down there, so I'll double check with Jackie. Jackie, who's hosting Byron? It's got 2 names. Gareth, right. So yeah, Gareth Hardacre will introduce you. Am I doing navigation of the...
We've just been leaving it up.
Leaving it up.
Okay. We haven't done that. It's not everyone's capable.
Yeah. No, that's fine. Yeah, so I think Gareth will host you, Byron, and then you can start.
Okay, great.
We'll just wait for people to join now.
Oh, it's okay.
Let me know if you need anything, Byron, but I'm gonna put myself on mute for the time being while we
and I'll do the same. That's fine. Yeah,
while we wait for people to turn up.
Thanks, Emily. Thanks for sorting that out.
No worries. I'll see you in a second.
We'll just give people a couple of minutes to come back in. We're not quite 1 o'clock yet. I don't know whether you guys can see how many are back in the rooms, though.
Looks like it's 32 Gareth.
Yep, 32 so far.
Just give you a couple of minutes. Cheers, Lloyd. Good to see you again.
Yeah, no worries, and you. Hope you're well.
Okay, I can see we. How many are we expecting, roughly? So, do you know what the number was this morning?
167, roughly, this one.
So we're still quite low at the moment. We'll just give it 2 quick minutes before we start. Just bear with us, Byron, if you don't mind.
No problem. Yeah.
I was going to say it feels a little bit probably like a count in one of the elections in America, but probably that's probably the wrong thing to say at this moment in time.
Think we might all have to sing a song, Gareth.
No.
You can go first, Louise.
We're creeping up quietly, you know. Right, okay, we're getting up to around about the 60 mark now, so I'm just conscious we're going to want to finish at 10 to give people a chance to jump out and get into the various subgroups for the breakout rooms, etc. So perhaps we'll kick on. Okay, welcome back, everyone. Hopefully you've enjoyed your lunch and you've been able to get some refreshments. It gives me great pleasure now to welcome Byron Lee as our next speaker. Byron is a well-renowned international coach and speaker, and he's going to talk to us about complacency or care. The pandemic has really shone a light on some of the health and social inequalities that have hit us, and particularly around disease in both public and policy and practice, and it really is driving that widening inequity out there in society. As an NHS, we are well versed with compassionate leadership, and some of you colleagues will have attended recent sessions that we've had from the likes of Professor West, for example, and some of the masterclasses. So it'll really be interesting to see how Byron really shines light on some of those difficult issues, those observations and questions that perhaps sometimes we don't want to ask ourselves in thinking about how we bring about change. So without further ado, I'll hand over to Byron, and if there are questions, if I could remind you to put them in the chat box, and we'll keep an eye on those as we go through, and we'll try and pick those questions up at the end then when Byron has concluded his session with us. Over to you, Byron.
Thank you, Gareth. Yes, and yeah, pleasure to be here. So, and thank you for the introduction. I'm curious about the international piece, because I think with the latest technology, we've all become international speakers and in different spaces, because anyone from anywhere in the world can actually join in. So I'm loving that expanded version of definition, which it's the first time I've had that introduction. Although I have worked around the world and never seen myself as an international speaker. So thank you for that introduction. And it's great to have this opportunity to share with the group today and this afternoon. I think maybe setting a bit of the context, as you mentioned, Gareth. You know, one of the things that COVID-19 has done is has shone a light on the disproportionate impact of COVID-19 on specific population, which has become a significant feature of the spread of COVID-19. And what I wanted to offer those in attendance today is an opportunity to pause and reflect on what this might tell us about, both health inequalities, but also from the point of view, and I'm a pragmatist, is how do we effectively manage the health and social impact of the current crisis without amplifying inequalities, and also with wise actions, how we could use this as a platform to address long-standing inequalities. So that's the thinking behind that. So my hope is that this session between now and, as Gareth was saying, we'll stop give you a 10-minute pause before the workshops. It's probably maybe pose more questions than answers, but in doing that, questions that might help. And I thought I might start with a kind of personal story about why I find questions really important. It goes back many years. So I did my nurse training back in the 80s, and I'm reflecting back 35 years. And I nearly didn't finish my nurse training, because in one of my very earliest placements as a student, I was on a what might be described as a fairly typical ward, a Nightingale ward at the time. And as a student nurse, I got my midterm feedback, and the headlines on this feedback was that I was bolshy, and it took me back a little bit, and I took a moment to try and work out, kind of felt quite personal, but I then asked what that meant, and I was told that the problem was that I asked too many questions, and which I found quite curious at the time. But I think one of the things that was happening was that some of my questions made staff uncomfortable, because what it established was that many of the practices that were going on at the time had no real benefit to patients, but were more part of the kind of idiosyncratic whims of senior clinicians. And in some ways, my questions were kind of holding them to account. And in a way, at the time, I took it, as slightly as an insulting thing to say bolshy. But since then, I've actually taken it more of as a compliment. And what it's taught me is that asking questions is important. I think one of the things I have learned, which is a very kind of my journey, is that there are ways of asking questions that are less threatening. So that's been my journey about, as a 20-year-old, someone not experienced, it was a great learning experience, but actually thinking about how important questions are in terms of thinking critically and in creatively. And I'm reminded of a quote that comes from one of Einstein's quotes is that he said, the important thing is to not stop questioning. Curiosity has its own reason for existing. And I think there's something quite useful, important to think about, what we are facing right now in terms of the COVID-19. So again, I'm going to share with you some observations. Some of them may be familiar to some of you, some less so, and I'm hoping that it will stimulate some thinking beyond, maybe beyond some of the thinking that might be going on at the moment. So the first thing I'd like to share with you, for those who are not familiar, is that currently we're talking about it as a global pandemic. And there was an author back in the 1990s called Meryl Singer who introduced the concept of syndemics. And those who are not familiar with what a syndemic is, syndemics differ than pandemics in some important ways. And I'm going to maybe show a slide here for you around this. And the important thing about the syndemic is that they're characterized by the interaction of a disease with conditions and biological and social situations. So they interact in a way that makes a person's person or population's susceptibility to harm or worsen their health outcomes. So in a way, what we have here is a situation where we can see the patterns of the disease following lines of inequality. And we've seen that sort of played out not only in the UK, but actually on a global sense. And also from a very practical point of view, syndemics allow us to recognize, as Mendelor was mentioning in The Lancet, it helps us to recognize how political and social factors drive, perpetuate, or worsen the emergence and clustering of diseases. So it's really saying it's not only about the way that healthcare treats the disease itself, but also how health and social policy can influence the actual distribution of disease. And in some ways, it's really highlighted the fact that inequalities and health conditions that are linked to inequalities actually have a profound effect on how COVID-19 appears to be playing out. I maybe share another diagram which maybe sort of illustrates the point about the outcome of a syndemic. Again, this is a model. It's not necessarily a model that everyone necessarily agree with, but it does offer a very different perspective on what we're trying to manage. So here in this particular diagram here, we talk about the kind of biological interface with COVID-19 in its co-infections, resistance, malnutrition, frailty, non-communicable diseases like diabetes and hypertension, and also mental health, and all those things influencing the outcome there. But importantly, the socio-ecological interface, so things like social behavioral factors, physical environment, social marginalization issues, and government policies, all those things influencing the outcome of a syndemic, which not only includes things like people's quality of life, increased mortality, but also, and there's evidence to show this in previous examples globally about the increase in suicide as an outcome of people's mental health conditions, and also poor self-management of non-communicable diseases as well. So it's worth recognizing that in terms of thinking about how we manage and respond to inequities from the point of view of a syndemic, if we're going to get, the thoughts are, and the observers are saying, if we're going to get to address COVID-19, and some observers currently are thinking it's more likely to become an endemic disease, then unless we actually address the issues around social and health and social inequalities at a policy level and at a public health level, there is an ongoing danger that it will simply both follow lines of inequity, but also could amplify them. And behind all the statistics, we need to remember the fact that there are human beings behind all these things. So increased numbers of deaths, the impact on domestic violence, and the impact on people with disabilities across the whole board. Those inequalities don't go away, and many of these things are exacerbated during this period of time and period of crisis. And also worth remembering, also in terms of some of the inequalities, unrelated ones. People were already struggling. So back in June, the Institute of Fiscal Studies did a report that looked at the actual impact on households. And again, this is for me a really useful reminder about when we apply policies at a kind of universal way, some of those policies themselves may actually impact adversely. So here we know that there's been an economic shock, but also they knew before the pandemic that, as it says here, 30% of low-income households pre the crisis said they could not manage a month if they were to lose their main source of household income. So I find it quite interesting, even though there's been a comment about furloughing as an example, it is very generous at 80%. 80% is generous if you have income, which if you do lose that 20%, it might mean the difference between whether you have, I don't know, a few luxuries or whether you're going to go on holiday this year. But for many families, actually, that's the difference between whether I can afford to pay my bills or not. So in some respects, universal policies which are applied across whole populations themselves can actually be problematic. And also, there's lots of other things we already mentioned about, been mentioned about the impact on schools, the increase in deaths, and also that it leaves many challenging legacies for inequality. This current crisis in itself has a risk of amplifying them, but also a number of commentators, and I include myself in this, is saying that from this there's also opportunities because it has shone such an important light on these things that people have been talking about for some time. So this is not new news, but it's news that's been very much bringing into sharp focus. So one of the things that I wanted to move on from this sort of broader context around COVID-19 is maybe making it a bit more specific and personal to you as individuals. And I could talk quite a lot about different things, but for me, there's the human factor in this. And one of the human factor perspectives I'd like to share with you is what's your perspective on this? So what I mean by that is there's different ways we could do this, but one of the things I share with people, and if anyone's heard me speak before may have seen this particular diagram that I've used, and I call it the learning edge around this kind of concept of positionality. Positionality is simply a kind of fancy word of saying, so where do you stand in this? And this is not saying you have a single position, but when we start talking about inequalities, one of the things we may need to recognize is that you may be someone, for example, who has lived experience as a result of the inequitable systems. So you may be the target or the recipient of inequities. You also might be someone who's an observer or bystander. So you may not be personally affected, or the people around you may not be personally affected by what's happening, but you're also somebody who's observing what's happening and recognizing that. Very often one of the learning edges around this is about how do we move from being passive observers to being much more active observers or bystanders. How do we get more engaged in what we're observing going on? The third one, which I mentioned here, which often is more challenging for people because it requires us to kind of acknowledge something that sometimes is an uncomfortable truth, which is also, when are we the source? What are the things that we're doing that may actually be creating difficulties for others? Very often unintentionally, but also part of that is saying, actually, in recognizing that we might be the source, it also helps us recognize we can also be part of the solution. And lastly, and this is particularly relevant to those who are in leadership roles or involved in policy work, when are we the architects? When are we the people that are involved in creating the systems, and those systems by themselves might then influence the outcomes that are there? And now these things aren't fixed, and we can shift between any of these. But for me, in terms of the personal perspective on this, is asking the question, what's my position in relation to this? And in thinking about what my position in relation to this may also then help us think about, so what is it that I can influence? What's the scope of my influence, and what's the scope of my motivation to want things to change? So with this in mind, I'm going to drill down a little bit more and pick up something that Gareth mentioned, which is around the kind of compassion piece, particularly in light of the idea that around human factors. So there's a quote that I like that was written by a medical ethicist called Eric Lowy, who quoted, "Indifference, not cruelty, is the opposite of compassion." And the reason why I find that quote particularly helpful is that if we use cruelty as the opposite, most people that I know, and I'm sure you know, and people in this space that we're sharing, would find it quite unusual to describe ourselves as being cruel. It'd be very unusual to find a cruel person engaged in this sort of conversation around healthcare inequalities. We recognize that people who are cruel do exist, or cruelty does exist. But when we come down the conversation about indifference, I'd find it very hard to meet anyone who at some time in their life wouldn't be willing to hold their hand up and say, yeah, there have been times when I've been indifferent. Or another way of framing that that I've used in the terms of the title of this piece here is complacent. That we may not necessarily have done something that actually maybe we could have done something, but it actually didn't attract us enough, or didn't feel that maybe we didn't feel empowered enough to do something. But in a sense, compassion, and this is something I share quite often, is compassion is not necessarily simply a sentiment. Compassion is an action. So when I hear people talk about being compassionate organisations or compassionate people, one of the questions I ask, and sometimes experience is rather threatening, but it is for me a legitimate question, is so what are you doing? Because for me to actually hold that measure of being compassionate, for me says there's action that is being taken. And I'll come back to this a bit later in terms of thinking about these ways of defining things. So in a kind of personal level, this idea of indifference or complacency, I think it's something that anybody can find themselves in, both individually and collectively. But also there's a couple of other layers to this I want to share with you, which I think are important when we start considering the role of compassion within the work that we might do. And it's based upon some of the work that's done around organizational compassion. And there was a quote that I use here is around the inevitability of organizational pain. And it's a piece that's written about, and it's been written about in other places, is recognizing that in any organization like life, there are things that happen which are painful. So for example, it's a bit like the idea that loss exists. If we even take it at a much more personal level, people die. And there may be reasons why we could avoid those deaths, but death is inevitable in everybody's life. And so I'm reflecting on a personal experience in terms of when I worked in the kind of palliative care field was that, one of the things I was involved in was around training. And one of the things that we talk about is how do you break bad news? And so one of the things you can't avoid is breaking bad news. But as Christina Dempsey wrote in her book around, I'll come to in a moment, but it's when people express the pain, it's an opportunity to connect. And express compassion is a response that affirms the human connection. So for me, compassion is about how do we connect with what we observe and what's happening. And again, I'll come to that in a little bit more detail. And what I was referring to in Christina Dempsey piece was the book around the antidote to suffering. And it refers to this idea of preventing avoidable suffering. So if I go back to my example a moment ago about breaking bad news, you can't avoid breaking bad news, but what you can do is you can avoid the suffering that's created by how you break it, where you break it, when do you tell people, what support's available to people when that happens. There's a whole host of things which can actually soften the blow of these things. So in some ways, I'm bringing lots of different ideas together, by the way. So the inevitability of organizational pain, for me, is not to suggest for a moment the inevitability of death as arising for COVID-19. It's more about recognizing that where do we place our attention to? What things can we change and influence? A really good example, I think, in terms of inclusion would be, I'm sure some of you have noted about the commentary that's been going on for the last 6 months, if not longer, around people who lip read having difficulties with people wearing masks. So this is not a new thing. And people have known about this since February, March, maybe before that. I mean, beyond that as well. And I recently saw a memo go around from a healthcare organization, which seemed to be celebrating the fact they now had access to masks provided sort of a little window that people could see their lips. But what was shocking from my point of view is this was stated in September. So for 6 months, people have been waiting for a response to people's requirements. Since these masks have been available for years, they're not new masks. And I find it quite interesting about people were struggling and there was a need for action, and the preventable, avoidable suffering was the time taken to respond to the request. So for me, there's this kind of scenario in which, these simple things to some people might seem insignificant to some, but to others might be very significant. I offer that as an example, not as a criticism of any one specific and individual organization, but to illustrate how easy it is to be complacent in the light of something maybe not necessarily being on our radar, but actually could also be a way of preventing avoidable suffering. And by the way, you can actually order these masks within a day or two if you went to a site outside the normal procurement process that people might find themselves in. So I want to kind of come into an opportunity for a conversation. So we are going to break out into smaller groups in a moment, just for a conversation around some of this stuff. Before we do that, I want to share a way I've framed compassion because of the work I've done over the years involved in leadership. And what I did was I put together a kind of amalgam of ideas that for me helped me frame this idea of compassion. So I'm not claiming any ownership of a specific model. I'm just sharing this as the kind of way I framed it and a way of elements of compassionate responding. And so from left and right, this is for individuals and also organizations, by the way. So it's not solely about how we respond as individuals. But the first point about any compassionate response is we have to notice what's going on. We have to be open to what's happening. We have to be attentive to what's happening. We also have to be present to what's happening. And there are certain skills and qualities required, because sometimes that's really uncomfortable. Sometimes that's quite difficult. And sometimes we don't have access to it. Sometimes it's out of our scope of awareness. So in some ways, noticing what's happening. And I certainly know in certain parts of elements of different public sector organizations, the idea of setting up networks of people, affinity groups for particular needs around protective characteristics, whether that's around disability or LGBTQ or around race. This idea of having groups in which people can engage and have conversations, so people can start to realize that the lived experience is sometimes the things that people aren't aware of, and the reasons why people might not necessarily be aware of it. So actually being attentive to what's happening is really important. But the second point about in this is that then we have to connect with it. So we may notice it, but are we concerned about what we see or hear or notice? Do we have a genuine empathy that's there? Do we care about what we're hearing? Does it fit with our values? And I'll come back to that a bit later again to help understand that, when we connect, sometimes it's that connection with our deepest values. I think, actually, this really matters to me. Now, typically, and this is where I brought in the stage of understanding, in many organizations and individuals, once people know there's a problem, the danger is sometimes people rush to action, often well-intentioned, but that might be typically perceived as rescuing. And the problem with rescuing behaviors is it actually assumes lots of things about the people who are going to receive the support. I use an example, a maybe slightly flippant example, but a real one, which was had a colleague of mine who's a wheelchair user, and she was in a city waiting for a taxi and by the roadside, and as she was waiting, some person who thought they were a good Samaritan of some kind came behind her and pushed her wheelchair to the other side of the road, thinking she was trying to cross the road. At which point she said, "What have you done?" I was waiting for a taxi, and the person who did it was a bit shocked because they were kind of waiting for a thank you, which wasn't going to be coming because now they're on the other side of the road when they've been waiting. So the assumption being that they didn't understand what the need was. So for me, once people connect, there's a need to engage, listen, and understand what the deepest needs are. In my experience, that can sometimes be the most challenging piece, because when we properly understand what needs sit behind what's happening. So, for example, there may be communities who actually need to feel empowered and resourced, not for people to make decisions for them. And it is the absence of resources and support around resourcing that have been the factors that have influenced the outcome. So in some ways, the kind of the action, so the acting bit in terms of collaboration might be to step back. And the collaboration might be to enabling and resourcing a situation and acting with altruism and courage as well. So I offer that as a kind of way of thinking about framing these ideas. And I'm going to pose a couple of questions. And so the first question I pose is, as leaders, how can we be attentive to what matters most to the people around us? It's something which is always worth remembering. You're busy people, and I think probably even busier now with COVID-19 and other things happening around. We're very busy, but how do we stay attentive to what matters, attentive to those needs? And a supplementary question to that is, who and what is deserving of my compassion? And what I mean by the who and the what is who in terms of individuals or populations, but what are the causes that you feel that you could be compassionate towards? And I'm going to pose that question for you to have a conversation in smaller groups. But to precede that, I'm going to share with you a short film around something that many of you may have come across, which is the bystander effect. It's a couple of minutes long. And at the end of this, we're going to put you into smaller groups of 3s and 4s to have a conversation about this question about who is deserving of your compassion, but also maybe some reflections of understanding this idea of bystander effect when people are in need of help. So,
Plays like this street in New York City. If you were unfortunate enough to be the victim of a crime or taken ill unexpectedly, you might think that surrounded by all these people, someone would intervene. After all, isn't there safety in numbers? Psychologists say no. Research suggests that often a victim is less likely to receive assistance when surrounded by a group rather than a single bystander. When people are in a crowd, it's easier to pass the buck. It's what psychologists call the diffusion of responsibility. Liverpool Street Station in London, a busy thoroughfare for commuters. Unknown to these passers-by, Peter is an actor. As part of an experiment on bystander apathy, he's pretending to be ill.
Help! Help!
How long before he gets help?
It looks as if we're having a bit of a technical issue. Just bear with us.
Help! Help me, sir. Please help me.
Helping would be inconvenient or even risky. He lies there for more than 20 minutes and no one raises an eyebrow.
Please, somebody help me.
It's always very distressing to watch situations like this where people are obviously suffering and no one's actually helping them. But what we have here is two conflicting rules. One is the rule that we ought to help, and the other is the rule that we ought to do what everybody else is doing. And here you have effectively a group of strangers who are exerting the pressure not to intervene, not to help. And it's very difficult to rebel.
Ruth, another actor, takes Peter's place. How long before she receives help? Four minutes later, and 34 people have passed without stopping.
Well, people don't really want to know. They just haven't got the time. Well, they have got the time, they just don't want to get involved.
Unwittingly, these strangers have silently formed a temporary group with a rule: don't get involved. They're afraid to stand out from the crowd and won't take action if no one else does. This woman has clearly spotted Ruth, but she conforms to the rule and does nothing. Watch what happens, though, when someone else helps.
You alright? You alright?
Yes, thank you.
Sure, you look a bit clicky, you know what I mean?
She suddenly finds herself in a different group with a new rule: to help.
You want to sit up?
She don't look well, does she?
You alright, yeah? What's wrong?
First I thought she was dead. Then I sort of checked to see if she was breathing or not. And I looked around and I couldn't believe that no one had noticed her, because there was a bloke sat there just absorbed in reading a newspaper.
This time, Peter's dressed as a respectable gentleman. Now that his dress is in keeping with those around him, how long before he's rescued?
Hello, sir. How are you today?
I'm alright.
6 seconds. She even calls him sir, and suddenly everyone's a good Samaritan.
Do you suffer from epilepsy?
No.
Why you're lying on the floor in the rain?
Because he's part of the right group, everyone wants to help.
I would just hate to be in his position of feeling ill and nobody helping and walking past, so I'd just like to check that he was okay.
And I thought, well, it's wet, so he must really be ill because he's going to ruin his suit anyway.
Plays like this.
Okay, well, so thank you. So there's an opportunity now, and I'm going to put you into smaller groups, just about 5 minutes to have a conversation, particularly around maybe your reflections of the video, but particularly around this question from your personal perspective. You know, who and what is deserving of your compassion and your response in terms of them having a difficult time or suffering. So I look forward to hearing your thoughts back in about 5 minutes' time, when we could join back together as a whole group.
Okay, we got some people on the line, Byron, who have got accounts and are moderators. So Claire.
Hi, Sarah.
Hi, Claire.
Seems to be.
Oh,
No, we've got
Claire Smith.
Okay.
Can you hear me?
I can see Claire's name at the bottom.
Yeah, I can hear you.
Because you've got moderator access, it must be aligned to your account.
Okay.
You didn't go in with the rest of the participants. So if you just join, if you click Manage Breakout at the top of this page,
Yeah.
if you click to join one of the rooms near the bottom, perhaps join room 17 with James and Harrod, because there's only 2 of them in there.
Okay. Thank
Can you see that? And just click Join Room 17.
Join group 17.
Got it?
Yeah.
There we go.
Yeah.
Okay.
Thanks. Thanks, Emily.
That's okay. We've We've got one group of two going on here, Byron.
Fine, that's fine. Yeah, no,
Right.
they haven't got a lot of time, so in ways they've got an advantage because as long as they've got a conversation going, which is
Yeah. Okie doke. It's just weird. It doesn't always allocate it properly. It does random numbers. It's really annoying. Yeah. As long as they're in there having a discussion.
fine. Yeah, good.
I think it's just me and you left in here now anyway.
That's right. We could have a chat.
Now you haven't got loads of people listening to you.
Well, it may be.
Oh, yeah.
So, I'm hoping they're finding it interesting anyway. So
I am. It's really interesting. It's great that we get to listen to these sessions as well, and
yeah,
by default, because we're helping out, we get free entry in a way, through the back door. But yes, it's good. It's good to see you again. I feel like we see you all the time now.
I don't know, eh? Yeah, part of the furniture.
Part of the furniture. You're practically in our team by now. Have you got sunshine with you today? We've got a bit of sunshine.
Yeah, we have actually. It's been lovely. Yeah, I mean, it's interesting being in Bristol. Sometimes we get the weather that's come over from bits of West Wales, and sometimes we don't. Sometimes it stops at the Bristol Channel and just pauses.
And just doesn't go any further.
I know. Yeah. Yeah, it's true though. Sometimes when you go over the bridge, you can be sunny on Bristol, and you cross the bridge and it starts raining. It's like, what happened?
You come to Wales, that's why. I know, it's really sunny here. We've gone out for a walk a couple of times, and it's actually quite warm. It's crazy. But this morning, freezing.
Yeah.
Absolutely freezing. I had to defrost and missed my windscreen.
Well, hold on a second, Emily. Somebody's talking in the background. I can't.
I think it's just Louise. We're in the same room as a couple of other people.
Oh, sorry, somebody's talking to me. Sorry, 3 of you in the group.
Oh, I can't hear that.
Okay, you can break out room 1, and there's only 3 of you, say. That's okay. If there's only 3 of you, that's fine. It was 3 or 4. If you've got a conversation between 3 of you, that's absolutely fine. Yeah, we're going to be finishing in about a minute anyway, so if you want to go back and just continue your conversation, that's absolutely fine. Thanks for mentioning that. Okay.
I couldn't hear that. I couldn't hear anyone else at all.
Okay,
online.
I think somebody's got a direct link to the moderator. I don't know how they do that. That's an interesting feature. So they can talk.
So some people, I'm not sure how that happened, but some people are account holders because they're part of our leadership networks, or they've been running training using our platform.
Yeah.
And I think that through that they've got moderator access linked to their accounts. So when they're coming into the events, whereas usually, they'd be a participant, they're coming in as a mod with moderator access.
Sorry, Emily, I'm just going to go into room 5 because they've asked me to join them. So I'm just going to go in there for a minute. Okay.
Okie dokie. Yeah. There's something up with my fee. There's something up with my virtual classroom. Is it? I can't hear. There's something up with my virtual classroom. Someone was talking to Byron then, and I couldn't hear the person, and he was like, they're talking to me direct from the room. I'm like, how can they do that? And I couldn't hear them, only he could hear them. It's really weird. And I'm seeing different numbers of participants to other people. Really disconcerting. Maybe I shouldn't host it anymore. Yeah, I can't really refresh because I'm recording and stuff, so I gotta.
When I launched the new session, I just
Yeah, Jack, something really weird is happening with my account. Something really weird.
Okay, I'm just ending the conversations now. Kim Tovey was on her own, by the way. That's what happened. That was a call. So somebody was on their own, Emily.
Oh no, I don't know how that happened.
Yeah, we just need to let them know that happens. I think it happened last time I was running breakout.
it's Byron. I think Byron.
Did Sarah push something? Somebody who's a moderator push something.
Hello.
Hello, who's that?
Yeah, sorry, I was in breakout room 2, and for some reason I've just come back. It's Claire. I've just come into the main session.
Yeah,
I come back.
No, I've just closed. I just closed. I sent a message a minute ago saying it's closing in a minute, and then I closed it. So you're back in.
I didn't see that message. Sorry.
No, that message didn't come through.
Oh, did it not? Apologies. I sent the message through saying that it was going to close in a minute. So apologies for cutting you short in mid sentence. I do apologise. This is a problem when they do this, isn't it? So, I just want to offer an opportunity, and we can use the chat room and also in the kind of wider space to maybe offer any personal reflections that came from your conversation. So feel free to use the chat room, which is down on the right, to type stuff up. But maybe if there are 2 or 3 people who'd like to share in the whole group about any personal reflections, either in terms of what they saw in the video or in terms of responding to that question about, who or what is deserving of your compassion. So, if you can raise your hand, Esther, you've got your hand up. So if you want to unmute yourself. I can't hear it at the moment, Esther. So do you want to try and unmute yourself now?
Can you speak now, Esther? She's coming through, I think, Byron. Might just need to give it a minute.
Okay. Hello, Esther?
Can you hear me?
Yeah, I can hear you, Esther. Yeah, go for it.
I think we agreed in our room that everybody is deserving of compassion. It's difficult to broach somebody lying on the street like that, but I think from my perspective, it's about culture as well. I think it's sort of cultural in a big city that you just turn the other cheek and walk away. Everybody's too busy. But I think the kind of people we are, I think we've all got a level of compassion. I wouldn't be able to personally walk past that person. I would have to be that person that goes up. So, and I think that was the same for the other people in our chat room.
Thank you, Esther. Yeah, it's a good point, and it's a good point about culture and whether this would be replicated elsewhere. I think the interesting thing about it is that there are plenty of experiments have shown that there are people who had said they would, but interestingly, they've also found that there are circumstances that nearly every person would find themselves that they might find themselves challenged to maybe follow a set of values that they have, and I'll come back to that in a moment. But in terms of people pausing. So for example, they found that circumstance could be a big factor. They found, for example, when people were in a hurry and they felt they needed to be somewhere that was important, would they be prepared to stop and help somebody in need, knowing that they would then not find themselves somewhere else that was important for them? And that was really interesting about those particular challenges. So you're right, at a very personal level, you probably find people say, yeah, everyone's deserving. Actually, the challenge is, if we really dig down deeply about ask that question is, are there maybe some exceptions in terms of our value set that we might find uncomfortable to acknowledge? And that's just maybe more of a broad rhetorical question, but I think it's one of the things that's worth thinking about. But thank you for that, Esther. And you've got your hand raised, so if you want to unmute yourself, you can come through and speak.
Yeah. Thanks, Byron. It's Anne-Marie from Hywel Dda. We had a conversation around how important it was to show compassion to your manager as well, recognising that during this pandemic, all managers have been working exceptionally hard to care for their teams. And sometimes, they are struggling and will show signs. And, someone gave an example where they felt they needed to recognise that and support in the upward sense, as opposed to just always relying on our managers to look after us.
Yeah, it's an interesting observation, isn't it? Yeah, because we're all human beings and we all have those pressures, and how can we share the compassion? So yeah, thank you, Anne-Marie. That's really interesting. Anne, have you got your hand up there? Did you?
I did. We were in the breakout room, and one of the things that I thought was that the film was quite old, and that it was showing what it was like at a time some time ago, whereas it may be different now. Don't know. I may be totally wrong. But that I'm a nurse by background, So that is caring and compassion, and I wouldn't go past anybody, regardless. However, one of the things that you've got to be aware of, and we discussed this in our group, was that it has to be safe for you to do it in the first instance. So you have to think of safety for yourself and for the individuals, but also call for help, so that for that person as well. And that could be taken into any situation, whether it's on the street, in an office, anywhere.
Yeah,
because you can't do it all by yourself.
Yeah, thank you, Anne. Yeah, again, really important points about, do we assess the safety. By the way, it is an old film. I've seen more recent ones, and I can show you recent ones. I'm going to show even recent today that still happens. And I do appreciate this is not a personal this is not a personal dig at anybody in this space. I think when we think about populations, we need to kind of ask yourself. So, for example, I've seen situations when you can place when you're in the caring setting. By the way, so when we talk about being in caring settings, they're actually much more controlled settings, and you have a specific role. You have a role there. So you're right. If you're a carer and you have a caring responsibility, it'd be very unusual to walk past. Be really strange. What the evidence suggests in terms of the bystander effect and population effects on individuals, it's very easy when people don't feel warmth towards a group of people, how they may not necessarily have a response that would support some kindness. Yeah. And I think there's evidence that shows that often happens without any particular malice. It comes back to this point about indifference. So when we say who's deserving of it, it's not only saying that I would go, I would go out my way or would I avoid them, but it's actually asking that question at a kind of deeper level, because in a way we might not be directly responsible for what happens. We can actually be part of a process that might be perceived as being slightly indifferent towards situations that might emerge. So a really good example, and again, for me, it's a good example. You may remember the time when there was a Syrian child, a young child that died on the beach following the crossing over towards Greece. I don't know if anybody remembers. In Lesbos, the child was being held by a volunteer, and that really struck a chord with people in terms of compassion. Most people don't realise that up to that point, when that child died, well over 10,000 people have been documented having drowned before them crossing. Yeah, that had been going on for some time before that child died. Then at that point, suddenly people were galvanised, and this is not a criticism. It's like suddenly the human nature piece kicks in. Somehow at that point, we're saying, actually, how can we allow this to happen? But it was happening because our attention wasn't in it, and there was a risk that we become slightly indifferent to that. Again, I'm offering these as observations to maybe stimulate your thinking, not as criticisms. More about, how do we change the system? Because if the system was working, we wouldn't have the inequality we have. So if everyone was like what people have mentioned already, that we would all stop and respond to everybody, then the system itself would be very different. And this is not about being in London, by the way, because these experiments have been done all around the countries in different countries around the world. So again, yes, there may be specific elements of certain areas, but actually it's recognizing that how we can be bystanders. I'm going to just take one more comment, by the way, and I got two other people. Steve, did you want to speak? Yeah, do you want to unmute?
Yeah, very, very quickly. Thanks, Byron. Again, we felt that potentially everybody is deserving of compassion. But we routinely and quite easily make judgments every day. We've become desensitized to certain things that we see on a regular basis. For example, it's a very common place to see homeless people and addicts in our town centres. And we generally walk past them. And if we were minded to help them all, then we'd be stopping all day long. So I think there are things that we've just become desensitized to and don't stir anything in us anymore.
Yeah, that's a good useful point, Steve, isn't it? Yeah, because it goes back to the point in the film, which is what's the social norm that's been created. And I think the social norm that's been created in some places, not everywhere, is that people walk past people who appear to be street homeless. We don't stop and find out how they are. Whereas if it was a person who didn't fit the kind of characteristics of somebody who might be street homeless, you might pause and say, "Are you okay?" Because they don't fit that profile. Yeah. So there's just something about recognizing. Again, not talking about individuals, about how individuals respond, but actually thinking about how that collective sense of social norms affect people's decisions. Yeah, Zoe, did you want to say something very quickly? Because I've seen your hand's been up for a while. So Zoe, would you like to unmute and speak? Can't hear you very much, Zoe. It's very faint. I don't know if your mic's near your mouth or are you able to? You want to try again, Zoe? Sorry, Zoe, we can't hear you right now. Apologies. I can see I can see a background. Hello? No, Zoe, we can't. Would you be happy to type something in the chat and we can have a look at what you've written, if that's okay? I do apologise, Zoe. This is one of these technical things on these things here. So I mean, there were several other observations about bystanders and all these things there, and I think it's a really important one in terms of recognising the importance of maybe holding on to those values. And I'm just very quickly, because I did mention that we're going to go away for 10 minutes before the end, and just want to share a kind of, I'm slightly reluctant to share this because it's quite detailed, but I wanted to share an observation about when we see things, what happens, just very briefly, but I will share these slides after today, and I'm happy to respond a bit more to this. But these are my personal observations about when we notice suffering, and it's a bit detailed, but in the center we notice suffering, and there's the inner world and the outer world that happens. And the inner world is that when we notice suffering, if we don't do anything, there's almost like a sense of moral failure, you know, and that moral failure actually kind of has things like, you know, and there are lots of factors that sometimes make it very difficult to respond. And I often observe that the people who are deeply compassionate, sometimes the system itself creates situations where people often feel very pressured to not, because they're not able to respond. And moral failure can often lead to feelings of shame that we're not doing what we need to be doing, both individually and collectively. Now, what's interesting about that is one of the things that happens at that point is that we can either go to the kind of social perception piece, so we can worry about what people might think of us, we feel embarrassed or may risk of humiliation. And what tends to happen is that people try to save face or be quite defensive or even deny it's happened. And therefore the status quo happens. A really good example of that is if a person, for example, and some of you may be familiar with the idea of microaggressions. Microaggressions are these forms of very small, subtle, sexist or racist or homophobic comments, but actually in of themselves are very small, but actually have quite a profound effect. So people often talk about it being a death by 1,000 cuts. And so when a person says that actually what you said there was, for example, racist, etc., people's response was, no, I'm not racist, without realizing actually it's a microaggression. And the comment in itself might not appear as a very big form, but actually it was, or it was sexist and those kind of things. So that moral thing. But the other thing that can happen in terms of the moral failure is to lead to a sense of guilt. And guilt in its form, when people feel like the self-perception, I haven't lived up to my own values. And people can actually end into a position of remorse, want to repair things, feel like they want to reconcile, and also seek some form of forgiveness for themselves or from other people. So in a way, guilt can actually lead to change, but in the short term. So it's kind of an interesting way of thinking about that. The other risk with shame, by the way, is going into depression, and we don't have time to explore that here. But there's in a world about things. And I often say, you know, this idea when we become passive and we're not doing things, there's a risk to ourselves in that. And the outer world is when we see suffering, we can have concern for that. And this is where the compassion piece has the potential to be enacted. Again, one of the risks to the left here is that suffering can also lead to pity, which is about feeling sorry for somebody, but actually not doing anything about it. So in a way, people don't want your pity, they actually want something done. It can lead to paralysis, and paralysis can arise because of complexity. So things are very complex and we don't know what to do. It can also be, as I mentioned before, about the numbers, which is interesting. There's a concept called compassion collapse that some of you may have come across before. But when I mentioned to you about the Syrian child who died on the beach, people saw that one story that was a really powerful story. But when we talk about 10,000 plus people dying, it's so big somehow we can't conceptualize it, and it doesn't really have the multiple effect. So people can get paralyzed by not knowing what to do. People can patronize by actually acting and rescuing people without really realizing what people need. And people then can pathologize. And one of the people mentioned, and I think it was Steve mentioned about, you know, if a person, for example, street homeless who maybe are using drugs, we then say, well, they did what they did, and it's really down to them. So we kind of almost attribute their failure, or attribute the reasons why they are in terms of their own personal failures. And therefore, there is very little compassion that happens. Whereas the other option is the compassion, which is all the things and more, by the way. Compassion, listening, understanding, collaborating, empowering, advocating, resourcing, leading, helping, all those things form the process of change. Now, it's a complex way of kind of capturing something. I just wanted to share this idea that, you know, all these things are happening very quickly, but if we want to break out that kind of sense of inertia, there is a developmental piece in this. So saying that I'm going to have this, by definition, this is me as an attribution, I think there's often quite a challenge in that, because there are circumstances we find ourselves in when sometimes it's difficult to be compassionate. And that's where it goes into the culture piece, you know, to create a culture where compassion can thrive. Yeah. So just very lastly, those two questions mentioned there is, how do you build the personal qualities and capabilities needed to lead with compassionate inclusion, which some of you already mentioned that you have already, which is great to hear. And how do we create the conditions needed for a compassionate, inclusive culture so that there are conditions in which these things can thrive that make a difference? And I'll end with just one simple quote, which I think is really important in terms of when we think about this idea about do we act when we see things and about the human factor. And it's the one that many people have come across in the Martin Luther King Jr. quote, which is, in the end, we will remember not the words of our enemies, but the silence of our friends. I think it's really important to remember that if we're going to shift cultures, it's not only about the people who are affected it by responding to it to try and make things better, but it's also about the people who are aware of what's happening. And if anybody has read the Margaret Heffernan book around willful blindness, which also refers to the mid-staff's account about things that happen, in those situations, it's not that people didn't know, it's people that did know, but who actually didn't feel either empowered or didn't feel enabled to be able to speak out, or when they did speak out, were ignored. So there's something really important about recognizing that. I'm going to pause at that point because I want to make sure everybody has a bit of a break. Gareth, I'm just going to hand back to you as the kind of moderator for this and say thank you to everybody for listening. I'm going to be exploring some of these questions in the workshop after this session. So if there's anybody who wants to kind of explore this a bit more, there is an opportunity there as well. So thank you.
Okay, thanks, Byron. That was really, really helpful and thought-provoking. I'm conscious that we've got the breakout session now happening in 6 minutes, so we need to give people a chance to be able to get out and get into their sessions. I'm actually coming with you to the next session and in the breakout, so I'll be with you there. So hopefully everyone can now jump off and join the relevant sessions that you've got to, and we'll follow this up with you in the next session, Byron. Thanks all.